All right, so hopefully, guys, you can hear me. Okay, so welcome to our Facebook Live tonight, everyone. It's June 15, Thursday, and we're gonna be having questions on next generation and NCLEX. So we have two questions, case studies that I have prepared for you, and we'll be doing a quick review also of what next generation NCLEX is going to be all about. So feel free to put your answers on the chat box, and then also I'll be discussing the disease condition, which is going to be a thyroid disorder for tonight. So far, what have you heard about the next generation NCLEX, guys? Now, but before anything else, I would like to introduce myself. My name is Mr. Alan Matus, and I'm a nurse educator, also nursing faculty. I have been teaching students for so many years, almost 25 years. And also, I wrote a book which in Amazon, which is published in Amazon now. It's the Simple, Fast, and Easy NCLEX Review book, which I will show to you in a moment. So I have been helping many nurses all over the years pass their licensure examination, and I hope that one of these days will be one of my success stories. But before anything else, I would like to welcome some of the people in our chat or in the comment section. I would like to welcome Mai Mai. Hi, Mai Mai. How are you doing? It's been a while. Mai Mai is one of my students, very nice students. I love you. We have Zora, Zindani, Canary Lopez, um, Kathleen Magno. Hi, Joe. How are you? One of my favorite students as well, Joe Bautsky. Kanza Umo, Anoro Odin Wonma. Also, we have Audrey. Hi, Audrey. So I'll be greeting some other people later on. Now, can you put in the chat box your location, like your country, for example, or your state in the United States? Okay. So, welcome again to our Facebook Live, everybody. So, let's have a little bit of an introduction, everyone. Okay. All right. So first and foremost, I would just like to introduce our upcoming 10-day live comprehensive NCLEX review webinar. It's going to be a blended learning course that combines live lectures and online assignments to master your nursing core content. So this will be in July 15 to September 16, 2023, every Saturday from 8 to 4:30 p.m. So during the review program, you will receive a workbook that you will be using to write information. And this workbook is one of the most amazing materials that you're going to receive for the 10-day live comprehensive NCLEX review webinar. So I'm going to show you the workbook in a moment. So again, our 10-day live comprehensive NCLEX review webinar is going to be on July 15th to September 16th. So make sure that you get your spot because we only have limited number of students. And also another one, of course, if you cannot attend our live NCLEX review webinar, then you can also attend our self-study comprehensive online NCLEX review course. So you could go online and then you can use a workbook to review. So it's an interactive core content review, highly organized and up-to-date test plan-based curriculum, of course. We have the NCLEX Success Workbook, your study plan calendar, hundreds of end of lessons NCLEX quizzes. So the next generation NCLEX questions, we have some questions in our NCLEX quizzes, but we do recommend for an extensive number of next generation NCLEX that you get your own Q bank. So you can get UWorld or Archer, for example, for your Q bank for your next generation questions. Of course, we have our Facebook Live video recordings and also our discussion group. And then also another one, this is the NCLEX Success Workbook that we use during our review program. So if you do the self-study program or the live webinar, you will receive the 400-page workbook that we have. And if you're a nurse who graduated a long time ago, or you're just a new graduate and you want an interactive review, this is the material that you can use. So I have been a nurse educator for so many years, so I exactly kind of like know the content that you need to know for your NCLEX review. So it's our best review material for NCLEX ever, the NCLEX Success Workbook. So it's 400 pages. Of course, my book in Amazon. So my book in Amazon is called The Simple, Fast, and Easy NCLEX Review. If you want to know your content, then this is a quick content review, something you can use before you take your licensure examination or NCLEX in order to review the content very quickly. So it has bullets, full color interior design you can see in Amazon. And it is a 5-star NCLEX review book in Amazon that I wrote. All right, so is everybody ready for our NCLEX next generation NCLEX question, guys? Are you ready, everyone? Can you please say hi? I would like to check out where's your location, everyone. Um, your location, California. We have USA. We have from Texas, also Houston. So welcome to our Facebook Live. And then next week or in the next few weeks, if we have another Facebook Live again, I will make sure that we're gonna have more questions. Okay, and hopefully you can zoom out the screen. Hopefully you can read the questions, or you're using your laptop because if it's a cell phone, it could be very small. Hi, Sandra from Indiana. Nice to meet you here. Amina, hi also. Okay, so let's have our first question for tonight. We only have 2 questions. I'll give you time to read the question and then process the information. Okay, and give your answers in the chat box, of course. And then in the next few weeks, we're going to have several types of next generation NCLEX questions. But before that, of course, we're going to review first um, basic background about your next generation NCLEX. So for your NCLEX right now, your test design, just a quick review. You have 85 minimum questions to 150 questions, and you have 15 non-scored items. The maximum for that is going to be 5 hours, and you have 3 case studies with 6 questions each. Is going to be 18 given before the first 85 questions. So meaning that you will have a total of 18 questions from your case studies. And aside from that, you will still receive more case studies after 85 questions. And then the exam is mostly composed of classic question format. So which means to say that don't think that your NCLEX totally changed. You only have a few questions from the case studies. Most of it still are the old NCLEX questions. So remember that, guys. And then the good news is you're going to have partial credit points for some question types now. So before, when you have the select all that apply, it's Either you get the credit or you're going to be zero, but now you get partial credit points for some question types, everyone. Okay, so another one, just remember that your cognitive levels, let me just make this bigger. These are the areas that you're being tested on for your next generation NCLEX, which means to say every time you receive the question, these are the categories or the areas of the clinical judgment measurement model. So some questions, the first one that you will see will be, is all about recognizing cues. Next will be your skill in analyzing cues, prioritizing hypotheses, generating solutions, taking actions, and evaluating outcomes. So, meaning that these are the questions for the next generation and NCLEX, especially when it comes to the case studies, because you have 6 questions. So the end or the last question that you will have is all about evaluating outcomes. And I think that is very important because as nurses, we need to be able to evaluate if our nursing actions are working or not. So expect questions that will ask you about determining if something is wrong with your patient, questions about taking actions, and questions about evaluation. So it's almost like a nursing process. But all of this, the purpose is basically really to measure your clinical judgment or critical thinking, everyone. So our new standalone items, so these are all the items for the next generation NCLEX. You have select all that apply, you have your select in, multiple response grouping, matrix grid, drag and drop down. So as we go through the questions, I'll be telling you what kind of question I have prepared for you. So for tonight, I have prepared select all that apply and a um, close that would be drop down, close drop down. So I'm going to tell you what kind of question it is. And also remember that you have 3 scoring for next generation NCLEX. I don't think that we have the scoring for next generation NCLEX. I'm going to give that to you next time. Okay, the slides. But for now, just remember that your scoring for the next generation NCLEX will be the number one is the 0, 1 scoring. The 0, 1 scoring is when you receive credits for correct answer. The other one is the plus minus. I think the plus minus is the one that a lot of students are like, oh, plus minus scoring. The plus minus scoring is the correct minus wrong. And correct minus wrong. So I'll be also telling you what questions usually will be a correct minus wrong. And then lastly will be the rational scoring. And I will be discussing that also next week, so the different types of scoring. So every time we do our Facebook Live, I'll be discussing the basics about next generation NCLEX, okay, as an introduction to our Q&A. So hi, Mark. Good morning. Hi, hello from the Philippines, and then we have Catherine from California. So everybody, get ready. 1, 2, 3. Let's have the first case study. These case studies are unique. These are case studies that I have developed, and I'm coming up with my new book, which will include the next generation NCLEX, of course. So I'm pretty busy right now, everyone, because I'm making a lot of questions about next generation NCLEX, especially including that in my revised textbook. Okay, so let's have the first question, everybody. Get ready. So I'll be reading the question and then I'll be giving you a little bit of time to process the question and then you put your answers on the chat box. Okay. All right, so here you go. This is the first question, our first case study, everyone. Okay, so next gen NCLEX question. Hopefully everybody can read the screen text. I know it's a little bit small for you, especially if you're using a laptop. So if you join the class again next time or this Facebook Live, I would encourage that you use a laptop maybe so that if you join the class again, so that you can really see the questions. Or you can enlarge your cell phone maybe, and then you can read the question. Okay. So let me just read for you guys. Um, the nurse in the clinic is caring for a 42-year-old client who has a diagnosis of hypothyroidism. Nurse's notes. So, nurse's notes, uh, 9 a.m. The client reports that he has been constipated and weight has increased another 3 pounds despite eating very little due to the lack of appetite. The patient complains of fatigue and has trouble staying awake at work. The client has problems remembering important things to do during the day and has been missing doses of medications. The client has a mask-like face and periorbital edema and tongue slightly enlarged. The feet and hands are puffy and cold to touch. Vital signs are temperature 97 degrees Fahrenheit, blood pressure of 92 over 50, heart rate or apical pulse is 58, RR is 11 breaths per minute, and the pulse oximetry is 95% there. So again, I will read the question. This is a case of hypothyroidism. The nurse in the clinic is caring for a 42-year-old client who has a diagnosis of hypothyroidism. Nurse's notes, 9 o'clock. The client reports that he has been constipated and weight has increased another 3 pounds despite eating very little due to the lack of appetite. The client complains of fatigue and has trouble staying awake at work. The client has problems remembering important things to do during the day and has been missing doses of medications. The client has a mask-like face and periorbital edema and tongue is slightly enlarged. The feet and hands are puffy and cold to touch. Vital signs, temperature 97, blood pressure 92 over 50, heart rate 58, respiration 11, and pulse oximetry is going to be 95% by room air. So I would like you to look at the situation because the question is which of the following assessment findings require immediate follow-up? Select all that apply. So number one, is it the bowel movement? Number two is the weight. Number three will be vision. Number four will be cold skin. Five, pulse oximetry. Six, blood pressure. And then seven, that would be respiration. So in this situation, what you have to do is to go back to the nurse's notes and read the information and find out what's wrong. Okay, so I'll give you a few moments to read the question, guys, and put your final answer in the chat box. In the meantime, I would like to greet the following people. Mark, so Tulip already has her answer. So what about the others? Do you have your answer, guys? So this is select all that apply. The scoring for this, everyone, is correct minus wrong. So this will be a correct minus wrong, minus wrong, correct minus wrong item, especially that you have to be careful, because any mistake that you make will be deducted from your correct answers. Um, so the scoring for this is what you call the plus minus scoring. Okay, the plus minus scoring, plus minus scoring. So the plus minus scoring is going to be your correct minus wrong scoring. Okay. All right, some of you have given your answers. Okay, very good. So Annie Turbio is given, and do you know that this hypothyroidism was one of the questions that they asked in the case studies? Okay, so let's find out the answer to this question, everyone. Okay, get ready, everybody. Okay, so get ready. Now, in this situation, everybody have to look back into the case study and find out what are abnormal. So whatever is abnormal in the case study, those are the ones that you will report or requires immediate follow-up. So look for anything abnormal. Now, the technique or strategy in answering this question, everyone, is when it mentions bowel movement, then you look first at the case study. And one of the strategies that the students can do is they can also write on the whiteboard when they're taking the exam, if that is allowed. You can write on the whiteboard all the information, and then you go back into the situation, and then you find out if that is, abnormal. So bowel movement. Let's see. Let's go to the final answer, guys. The final answer will be okay, so that's your final answer, everyone. So bowel movement, your weight, your cold skin, blood pressure, and then also you have your respiration. So don't forget number one is included. So we have some people with different answers, but let's go to the answers, everyone. Now, number one is included. Why? Because your patient has constipation, right? Constipation. Then number two, your weight. Your patient has a weight gain, so that needs to be requires follow up. Number four, you also have your cold skin. You go back to the situation. It says the feet and the hands are puffy and cold to touch. Also, you have your blood pressure is low. Blood pressure is only let's see, blood pressure there is going to be 92 over 50 only, everyone. And lastly, you have your respiration, which is 11 breaths per minute only, which is really very low. Okay, which is now within the normal range of your respiration. So all of these are cases of or signs and symptoms of hypothyroidism. So very basic, everyone. Okay, so those are assessment findings that needs a little bit of a follow-up because they are all abnormal and needs to be discussed with your primary care provider. Okay, so some people got number one. So the answer is 1, 2, 4, 6, 7. Okay, Amina, you almost got it, but Amina missed number seven. Okay, but good job, Amina. Sandra, you're missing some number one and then number six and seven. So take note of that. You really need to know your vital signs, guys. You know, vital signs, you look at the, maybe your cell phone is very small and you cannot see the question very well. So we'll make it bigger next time, or you can use your laptop also. And then that's it. Okay, so let's go to the next question, everybody, very quickly. Okay, so let's go to the next question, everyone. All right. So going back to this question, everybody, this question is a number one. This question is testing your recognizing cues, clinical judgment. Okay, recognizing cues, or meaning that you're able to recognize change in condition. And also, this question is an extended multiple response question or select all that apply question. And the scoring for this question will be a correct minus wrong. Okay, correct minus wrong because it's a like all that apply. The bottom line, guys, is this. I always tell my students that if the question allows you to click everything or check everything, be careful with questions that allows you to check everything because more likely those are correct minus wrong questions when you're able to kind of just like mark everything. So be very careful. Okay, be very careful. Now let's go to our next question, everyone. Okay. Okay, so for our next question, the same situation, there's no change. The nurse in the clinic is caring for a 42-year-old client who has a diagnosis of hypothyroidism. The same situation, but the question now is complete the following sentence by choosing from the list of options. Number one, the client is at risk for developing a select, is it thyroid storm, is it myxedema, or is it adrenal crisis? So all of these are endocrine disorders or endocrine complications. However, you have to go back to the symptoms and then find out what's the complication that's developing. So what's the highest risk in this situation? Because of what you see, the client is at highest risk for developing what? Is it thyroid storm, myxedema, or adrenal crisis? Can you also put in the rational, the rational why you put your answer? Okay. Why is it thyroid storm? Why is it myxedema, or why is it adrenal crisis? What do you think is the reason? Going back to the situation. So this goes back to your content review. One of the most important things when you study is to know your signs and symptoms. You really have to read the case study and then find out, what's going on with your patient. I will tell you one thing, guys. NCLEX is not going to tell you what condition is present. Okay, NCLEX is not going to tell you. So you have to look at all the symptoms. These symptoms are going back to what? Okay, thyroid storm, or is it hypothyroidism, or is it myxedema, for example? So look back at all the symptoms. So meaning that And then it goes back to your content as well, knowing what is thyroid storm and then what is mixed edema or what is adrenal crisis. So things that are important to remember. Okay. All right, so let's go to the answer to the question, everyone. What's going on to this question? I'll give you a clue a little bit before we go to the answer. Now, for this question, everybody, you look at the situation or the case study. What you're seeing, everyone, is this patient is having hypothyroidism. But some of the key words that's really standing out in this question will be um, missing doses of the medication, or thyroid medication. So he's been missing his thyroid medications. And what will happen if you are missing your thyroid medications? Are you going to develop thyroid storm or myxedema? Right now, we will eliminate adrenal crisis. Adrenal crisis is not a complication in this situation. Adrenal crisis is something that happens when you have a very low level of steroids, that happens to patients with Addison's disease. So we eliminate adrenal crisis because this has nothing to do with steroids here. Now, the situation is you have hypothyroidism. So think, what are the complications of hypothyroidism? What is the worst form of hypothyroidism? So Amina said myxedema without medication, myxedema because of hypotension and bradycardia. So really look at the question. Okay. So I know that most of you, when you read your book, you always see the word thyroid storm. So sometimes, remember in the NCLEX, it's not really what you hear all the time that's the answer. You really have to know what's really going on with your patient. Don't choose an answer just because it's something you've been reading a lot of times. So the answer to this question, everyone, is going to be all right. So that would be your mixed edema, everybody. Mixed edema, which is a condition, a worst form of hypothyroidism that can lead to even a comatose condition. Now, can someone tell me in the chat box the things that happen when you have mixed edema coma? Because mixed edema coma, everybody, okay? Mixed edema coma is a condition where you have, what happens in mixed edema coma is you have hypothermia, okay? What else happens, guys? Hypoventilation, okay? So you have hypothermia, you have hypoventilation also. Um, Aside from that, hypoventilation, hypothermia, and then there's another one, and I forgot. I think it's bradycardia also, definitely. Severe signs of hypothyroidism, hypotension, hypoventilation, and I forgot the other one. I know there's altered level of consciousness as well, but there's another one. It starts with letter H as well. Um, Altered sensorium, everything is low. Okay, altered sensorium, yeah, that's correct as well. So our immediate treatment for patients with myxedema is going to be to give your thyroid medications. Okay, so you have to give your thyroid meds. Very important. Yes, that's correct. Hypothermia rates. Give your thyroid medications. And of course, airway is a priority. If you're going to be asked in the NCLEX, what's your priority for myxedema, is going to be your airway because there's hypoventilation. Airway and your breathing, definitely. So your patient may be placed in a critical unit just to kind of like manage the condition. Okay, so that's all about your myxedema, guys. Myxedema is the worst form of hypothyroidism. It's an emergency. It is a crisis. It happens when patients' thyroid levels are really very low. And always remember, just a quick review, what is hypothyroidism? Hypothyroidism is when you have very low levels of T3 and T4, your thyroxine, and triiodothyronine. So review the signs and symptoms of those conditions, guys. Okay, so I hope you learned something for tonight. So this question that we have, this type of question is what you call a drop down close question. Okay, drop down close. So let's type that down. Drop down close question. Okay, so drop down close question, which means to say that it's a close, meaning they can like fill in the blanks. All right. So And what is the scoring for this question? The scoring basically is you earn the point. So you earn 1 point. And what category of skill are you being tested in this? This is about analyzing cues. Analyzing cues. So this is not recognizing cues, but this is analyzing cues. Like your ability as a nurse to look at all of the signs and symptoms and data, and then you have to figure out what's really going on with your patient. Okay. And of course, normally in a case study in your NCLEX, you will have 6 questions. So I'm just giving you 2 tonight. Very important. If you don't know what's going on, then your interventions may also be wrong, right? So make sure that you know what's going on with your patient so that when you're being asked about interventions, you know what to do. Okay, so that's it, everybody, for tonight. Thank you very much for being here. And again, next week, I'm going to send out an invitation. Oh, we have a lot of people watching tonight. So I'm going to send out an invitation again for next week if we have a schedule. And I'll be giving you more case studies next week. I promise. Okay, if I am going to be here. Okay. Anyway, thank you very much for all your participation. I'm going to give a shout out. Congratulations for those people who got the correct answer for tonight. Okay. And Amina, congratulations. We have Ritz. Ritz has always been here. Okay. Audrey, Amina, Diz Piluden. Okay. And then share. And share with your classmates too. So thank you very much, everybody. And I'll see you again next week. It's a short Facebook Live for tonight. And maybe next week, I'm going to go back, giving prizes, free access to our online NCLEX Academy. So we will see you next week. Okay. So hi Menchi. Hello. Miss you. All right. So thank you very much, everybody, and have a nice night.